Venous drainage of the heart. The veins that drains the heart includes great cardiac vein, middle cardiac vein, small cardiac vein, right marginal vein, posterior vein of the left ventricle, oblique vein of left atrium, anterior cardiac vein, venae cordis minime, coronary sinus. Among this, the coronary sinus is the largest vein that drains the heart. As we know, coronary arteries are the blood supply to the heart. Meanwhile, coronary sinus is a vein or the sinus which is draining the heart. Apart from the coronary sinus, a lot of other veins like great cardiac, middle cardiac, small cardiac, etc. are draining the heart, but the coronary sinus only directly opens into the right atrium, and the remaining veins are directly opening into the coronary sinus, not into the right atrium. Then, regarding the clinical conditions of the coronary artery, the thrombosis of the coronary artery is very common, and it might be one of the reasons for the sudden death of the person who passed middle age. This is due to myocardial infarction and ventricular fibrillation. Incomplete obstruction of the coronary arteries causes a kind of chest pain which is medically called angina pectoris. Angina pectoris is a medical term used for the chest pain due to the partial spasm of the coronary arteries, and due to the partial block of the coronary arteries. Angioplasty helps in removal of small blockage. Angioplasty is a ballooning procedure which is used for removing the plaques, removing the blocks of the coronary arteries. If the number of blocks are more, then we have to adopt bypass surgery. So this is a procedure to bypass the block in coronary artery. Veins without valves as well as some selected arteries can be used for grafting the bypass. This is the diagram showing the procedure of bypass, in which you can see the aorta from which the right coronary artery and the left coronary artery arises. You can see a small blackish colored area which is showing the blockage of the right coronary, and here also one block. So, in the procedure of bypass, we are not removing the block of the coronary artery, but at the same time, we are grafting another bypass here. We are grafting another vessel to bypass this area. Like this artery, the artery which is used for bypass surgery is internal mammary. There is one of the arteries used for bypass surgery, which is lying along the lateral margins of the sternum, and some of the veins can be used, for example great saphenous vein. But the thing is, when veins are used, especially the great saphenous vein, when it is used for grafting the bypass or grafting or taking this for this procedure, if you are taking an artery, the great saphenous vein for this procedure, the surgeons has to make the valvular surface, because already we know the great saphenous vein is a vein which is taking, or it is carrying blood from lower part of the body to the upper part. That means it is carrying the blood against gravitational force. So there must be a tendency for the gravitational force to tend to pull the blood downwards. So preventing the backflow of the blood, obviously these kind of veins are having valves inside. While doing this bypass surgery, what we have to do is, we have to make the valvular surface outside and the smooth surface inside. Then only we can graft it here. So blood from the aorta directly reaches the area beyond the block. We know there is no need to remove the block. Then coronary sinus is the largest vein of the heart. It is used, or it is situated in the posterior coronary sulcus. It's about 3 cm long and ends by opening into the right atrium. It receives other veins like great cardiac vein, middle cardiac, small cardiac, posterior vein of left ventricle, oblique vein of left atrium, right marginal vein, etc. Here in this picture you can see the posterior aspect of the heart. Here the right and the left atrium are visible. This is the right atrium, this is the left atrium. You can see 4 pulmonary veins receiving into the left atrium, and posterior coronary sulcus, the left posterior coronary sulcus lodges the coronary sinus that directly comes and opens into the right atrium. But to this coronary sinus, we know this oblique vein of the left atrium, great cardiac vein, the inferior vein of the left atrium, then this is the middle cardiac vein, then small cardiac vein, all these are opening directly into this. Next is pericardium. Pericardium is just the covering of the heart, and this pericardium can be fibrous pericardium and serous pericardium. The fibrous pericardium is a tough layer, but the serous pericardium is formed from the original body cavity. Fibrous pericardium is conical in shape. In this picture you can see the fibrous pericardium. This is tough in nature. It is covering both the heart as well as the root of the great vessels. Root means the beginning of the great vessels like superior inferior vena cava. It is covering the area near the heart. The area near the heart, the part of the aorta, part of the pulmonary trunk which is present near the heart are covered by, or which is present, which is covering the covered inside the fibrous pericardium. And this fibrous pericardium has an apex and a base. In the lower part you can see the base which is resting over the diaphragm. In the upper part, this is the apical part, and this apex is covering the root of great vessels. Now anteriorly this fibrous pericardium is connected to the sternum. In this picture you can see a sternum here, and inside the sternum you can see the heart with the pericardium. And the pericardium and the sternum are connected by sternopericardial ligaments which is present in the upper part as well as lower part. These are the two sternopericardial ligaments that is simply connecting the anterior surface of the fibrous pericardium with the sternum. Then on either side the pericardium is related to the lung and the pleura. So the function of the pericardium is to protect the heart against a sudden overfilling as well as to prevent the expansion of the heart. Here in this picture you can see the green colored area. This is the fibrous pericardium. Then inside this is a serous pericardium with the 2 layers. The blue color is the parietal layer of the serous pericardium, and the red color is the visceral layer of the serous pericardium. Between the serous pericardium, between the parietal and the visceral layer, there is a space called pericardial cavity. This is a pericardial cavity which is filled with a thin film of fluid called pericardial fluid. So this slide explains the 2 layers of the serous pericardium, outer parietal, inner visceral. Between 2 layers there is a pericardial cavity with a thin layer of fluid. The next is sinuses of pericardium. Sinuses are the spaces, extra spaces which is present over the pericardium, and they are transverse sinus and oblique sinus. Transverse sinus is transversely placed and oblique sinus is obliquely placed, and these sinuses are present among the venous and arterial ends. Arterial end of the heart tube or arterial end of the heart is the upper part, where you can see the ascending aorta and the pulmonary trunk. Aorta and the pulmonary trunk are the 2 arteries related to the chambers of the heart, while the remaining structures are the veins. For example, superior vena cava, inferior vena cava, then the left pulmonary veins, 4 pulmonary veins, all these are veins. Okay, only the aorta and the pulmonary trunk are the 2 arteries. So between the arteries and the venous area there is a transverse space called the transverse sinus that is given in transverse arrow. A dotted arrow showed here is the area of the transverse sinus. But on the same way, this venous end, among the venous end, oblique sinus is present, which is this oblique dotted area. This is oblique sinus which is present among the venous end. So transverse sinus is present between the arterial end and the venous end. Oblique sinus is present at the venous end. This slide shows the transverse sinus, the finger which is putting into the transverse sinus. Regarding the clinical condition of the pericardium, pericardial effusion. Effusion means excess fluid. So this is in case of pericardial effusion, excess collection of pericardial fluid in the pericardial cavity. Another condition is a pericarditis, that's the inflammation of the pericardium. These are the two clinical conditions related to the pericardium.